Over the past decade, Africa has faced several public health challenges, from the devastating Ebola outbreak to COVID-19 pandemic. These crises have highlighted the vulnerabilities in the health system, but have also underscored Africa's resilience and potentials to overcome global health challenges. The 10th African Conference on One Health and Biosecurity is a platform for addressing the challenges with the aim to assess Africa's progress in handling health security threats and to explore strategies for building more resilient, responsive and collaborative health system. Governor Babajide Sanwo-Olu is represented by his deputy, Dr. Obafemi Amzat, says the outbreaks of Ebola and COVID-19 have tested the tenacity, exposed weakness in the healthcare system, and highlighted the urgent need for collective action.
In Lagos, we are actively working to strengthen our biosecurity frameworks, enhance our disease surveillance systems, and build a workforce that is prepared for the realities of the post-COVID-19 world. We are also committed to advancing local research, developing indigenous technology, and supporting domestic production of vaccines and medical supplies. We envision an Africa that is self-reliant, resilient, and a leader in global health.
The sessions with the topic Health System Strengthening, Strategy and Policy, Role of Government. Commissioner for Health and his counterpart in the Ministry of Environment say integrated biosecurity and One Health is a way of life which must be embraced by all, and both ministries are taking steps to regenerate the environment for the benefit of all.
The reason we're here is to bolster our Operation BioShield, what we used to deploy the protection against COVID. We meet every year to think about new things, to think about partnerships and collaboration, so that we can continue to build what we call the Lagos State Biosecurity Roadmap.
If we allow this continue, where people take waste and effluent and put them into a system that will now move and go and cause something else, it becomes a challenge for the healthcare system. And we found that out this year when we had the cholera outbreak. Thankfully, the two ministries had to collaborate effectively by deploying La CEPA, deploying Water Corporation, deploying La Swamo, and then deploying Loma to help mitigate the effects.
The Ebola and COVID-19 may have shown the vulnerabilities of the healthcare system. However, the National Assembly is prioritizing funding for the sector and also addressing the socio-economic factors which is a resistance against pandemic.
The House is committed to leading the change in this regard by reinforcing our health infrastructure, including enhancing laboratory capacity to detect new pathogens and expanding access to affordable treatment and vaccines, among others.
Obviously, the lessons learned from the threat of the pandemic are now being channeled into proactive measures to show the preparedness and response capabilities of the Lagos State government for future health emergencies. Olubukola Akin Kolusho, LTV News.